Ready.
Okay, all right. I think I heard that. So I'm glad to be able to talk with you all for just a bit today. One thing that I would just mention in general um, with regard to COVID, coronavirus, everything that's kind of been going on, what we've been kind of waiting for are additional tools that would kind of help us in this fight, against the virus. Some of the only tools that we had initially were, wearing masks, socially distancing, avoiding large crowds, and those will still be there. The vaccine is really just another tool that we have to help protect ourselves while we continue to do those other things. It is not a, silver bullet, magic bullet. It's not going to completely cure everything overnight. But again, it's just an additional tool. And I don't know if you all remember, but back when we had our end of year gala back in 2019, I mentioned specifically about the flu pandemic, that happened in 1919, and about how one of my great uncles, I think, had died of the flu when he was like 12. Um, the vaccine was not a tool that they had available to them. Really, all they had were mask and distancing. And you saw the results. So if you remember, I mentioned like over, I think, 600,000 people died during the course of that flu. And we are quickly approaching that kind of number now with all the things that we have available to us. Because in part, while we have been using masks and doing some of this distancing, there's been such disinformation and misinformation put out there. People have suffered unnecessarily. And Black people in particular have been disproportionately affected by that disinformation. And as a Black man, as a doctor, one of the things that really pains me the most is when people that look like me suffer unnecessarily. And I think there's been way too much of that that's happened with this virus. Any questions that you have about kind of what's going on so far, questions about the vaccine, how it relates to you, I'm always happy to help answer those. I know sometimes people don't want to ask a question in a group because you feel like, well, if I say this question, people are going to think that I think this certain way or what have you. If you want to ask it in private, you are always more than welcome to do that. But in general, I am all for the vaccine. I got my first dose about 3 weeks ago. I'm going to get my second dose on Wednesday. I got the Moderna vaccine, and just like my mom was mentioning earlier, I had some arm soreness, but pretty much that was it. But really, it is a vaccine that's going to be available for everyone. So if you have high blood pressure, diabetes, whether you use insulin or not, heart disease, whatever those typical issues are, you can still get the vaccine. The only people that I've asked to hold off on it for now are those who've had really severe allergic reactions. And I'm not just talking about, well, I used penicillin and I got a rash, but I mean, you had to use an EpiPen, you were in the emergency room in the hospital, that kind of allergic reaction. Outside of that, it's still available to everyone else. And like I was mentioning before, really with COVID, the idea is to not get it, to start with. Okay. So you want to do as much as you can to help protect yourself. You still need to wear a mask. Ideally, you want to use eye protection as well. Eye protection is really important, especially when you are in situations where not everyone is wearing a mask. So particularly on your jobs, when you're out at the grocery store, these sorts of places, there can be simple goggles, anything to help protect your eyes. Because if you imagine if that respiratory droplet, comes out of somebody's mouth who's not wearing a mask and it lands on your eye, that's a potential route of infection as well. And what you're seeing now more so in the news with new strains possibly being able to spread more easily, these modes of protection are going to be even more important. So now you're starting to see some information come out that's coming out to say that maybe you need to wear a better quality mask. So maybe we need to have people wearing either N95 or KN95 masks. Those do filter more to help give you some additional protection. Again, that's a tool that you can use along with, a vaccine to help protect yourself. And there's some questions about, this vaccine kind of being new and it was rushed through and it was done so fast. Messenger RNA vaccines, these type of vaccines have actually been around for several years. They were studied for other viruses like Zika. They've been studied for flu. They were studied for Ebola. They were studied for SARS, which came out in 2003, also a coronavirus. So that type of technology in and of itself is not new. It's the first time it's been mass produced for actual use right now. But if you kind of think about the way that it's working, sometimes people get confused and say, well, it's going to go into my DNA, it's going to be there permanently. What a messenger RNA virus is a message for your body's immune cells to know how to interact with the virus in the future. So if you kind of think about a spy movie, a lot of times if you get a message and say, okay, this message will self-destruct in 30 seconds, that's basically what happens with that message. Your body's cells will read that message, they'll get the information, say, oh, okay, well, this is how I fight that virus. Okay, and then it tears it up. Okay. That's how your body is getting that information about how to fight the virus. So I know it is a new technology and it's new to a lot of people. It's not brand new in terms of science. Ways it's kind of been researched over the last several years. So I'd say, I guess I'll pause right there and put a button in that. Do we have any immediate questions, or is there anything that I just mentioned that brought up any questions for you? And if Brandon or someone could type it in the chat in case I can't hear it.
Hey, so I have one type right now, and I'm gonna.
Okay. I know there was a question about if you've had COVID, should you get the vaccine? That's a really good question. So from what we know right now, it is unusual for somebody who's been infected with the virus. We know that you actually had it. It's unusual for them to get reinfected again within 90 days. Outside of that 90 days, we have seen some reinfections. So that natural immunity that you get when your body has been exposed to a virus for the first time, that natural immunity varies from person to person. Some people may encounter it and they may be good for 6 months, maybe a couple of years. Some people encounter it and that immunity only lasts a short while. We're not completely sure why that happens. There may be something genetic there, and maybe that's something that kind of runs in families. There may be an issue where maybe you just got you were exposed to a small amount of it. So imagine the virus was kind of floating along, a respiratory droplet, and you inhaled it. You had a very low kind of inoculation dose. You were exposed to very little of it, versus you being a doctor and you having to intubate somebody and putting a tube down their throat. If they're breathing out COVID through that tube, you're getting a massive dose of it. So you're exposed to a much higher quantity of it. So that maybe have something to do with it as well, but we don't know how long that natural immunity lasts. There's some indication it lasts about 90 days. So for those who have had COVID, I still suggest that you do get vaccinated.
Did you see the question about how long will it go in effect once you get your first dose?
I'm sorry, say that again or type it out.
You get your first dose long before it becomes.
Okay, it's still breaking up. I think the question was kind of how effective it's going to be after you get your first dose, or how long it takes to kind of go into effect.
Yeah.
Okay. Yeah, so good question also. So with the vaccines, the Pfizer vaccine, you get your first dose and you get the next one 3 weeks later. With the Moderna, you get your first one and you get the next one 4 weeks later. Really, your full immunity, your full protection from those vaccines comes about a week or two after your second dose. You do get some protection with the first dose, which is why it's important, if you go get your first injection and you want to kind of rip off your mask and kind of do whatever, no, like you can still get COVID, okay? So you're not fully protected until you get that second dose. And then it's going to take, because it's taking your body's immune system some time to process that information, so you get the full immunity. And let's see, okay, I see your questions here now. And then how long should you wait after pregnancy? Also good question. So you can actually get vaccinated while you're pregnant. Okay, so I've had several of my colleagues who have been pregnant early on in the pregnancy who have gotten it. The American College of Obstetrics and Gynecology said, you should not withhold the vaccine from anyone who is pregnant. So you don't have to wait. You can get it immediately after pregnancy or during pregnancy. Also, another question that comes up sometimes, if you've gotten another vaccine recently, they're saying wait 14 days. from another vaccine, just to be sure you have kind of, cleared that vaccine just in case you are someone who may have an issue with it. So you can make sure that you're not kind of looking at different things because sometimes it's harder to tell what's causing the problem if you take them that close together. All right. And I just want to say I did have another note. Other questions? Is it safe to mix vaccine brands? This was an interesting comment that came out recently from the CDC. And basically, we're saying in extraordinary or extraordinary circumstances, you can get a dose from a different manufacturer, if you will. And we're talking about specifically the Moderna vaccine and the Pfizer vaccine. I say if in emergency, you can do that, but I say for the most part, people should be able to get the same one that they got previously. So if there's an issue where it takes, a couple of days to get that original one, that's fine. So you want to stay as close to that time frame as possible. You can't get it sooner than that, but if it needs to be delayed a bit so you can get the same one, that's fine. But ideally, you should stick with the same one. So that's why it's important to hang on to your vaccine cards to be sure exactly, what you got before. And which vaccine is better, Pfizer versus Moderna? They both have about the same rates of efficacy. So either one is fine. I'd say if you're wanting to get it quicker, go with, if you have a choice. I say if only one is available, get that one. Okay. But if you have a choice and want to have a shorter interval in between, Pfizer is 3 weeks versus Moderna, which is 4. So also if that, impacts your travel or schedule, what have you, one works better than the other for you, that's okay. What is the age range for vaccination? So the vaccines were not studied in children. There are some trials going on right now. Depending on the location, for most places, it's going to be 18 and up. I think you will see some more um, guidance coming in the near future about adolescents in particular. So the way that these vaccines typically work, when they study them in adults, and then the age range kind of backs downward with some additional studies. Same thing, like you are not going to see any trials in pregnant women. So for the most part, trials aren't done on pregnant women. Women do become pregnant during the trial just because, things happen. So from what we've seen so far, it appears to be safe. So we have any issues with that. But I think you'll see that bottom age limit from 18 start to go down in the near future, probably even within the next couple of weeks, because you're wanting to get kids back into school. So the question is, okay, well, who are we vaccinating? What age is it appropriate? Is it safe to get the vaccine if I already have an underlying condition? I'd say yes, for the most part. This is always a question you want to discuss with your doctor. So the things I mentioned before, high blood pressure, diabetes, heart disease, I've had a stroke in the past, I've had a heart attack in the past. You are the people, if you do fall in one of those groups, that are at most risk for complications from a COVID infection. So yes, by all means, this is definitely a group that I would like to see get vaccinated sooner rather than later. Are there any severe allergic reaction risk? Yes, for the most part, from what I've read, the people who've had severe allergic reactions already had a severe allergic reaction to something else. So that's kind of what I was mentioning before. If you were someone who has to carry an EpiPen, if you've had a severe allergic reaction before, you're someone who needs to speak with your doctor in person to figure out what's going to be best for you. Um, there are people who have had severe allergic reactions in the past who have gotten the vaccine and have done just fine with it. So it may be that you are someone who needs to get it in a location where you have, doctors on standby, whether it's in the emergency room, what have you. That may be a better fit for you. So for example, I got my vaccine at a grocery store in DC because it's already pretty widely available here. If you've had an allergic reaction before, that's probably not the best place for you to go because basically it was just the pharmacist there. They're like, okay, we'll just wait over here for a little while. If you were to have had a reaction, that probably is not the best place, for you to get it. But if you have had a severe allergic reaction before, you should speak with your doctor about what they think is best. There is a newer vaccine, the Johnson & Johnson vaccine, which works on a completely different mechanism. It's not a messenger RNA vaccine that is hopefully going to be available in the next month or so. That is a single shot. Don't know when it will be available, how widely it will be available. Maybe that might be a better fit for those who have had severe allergic reactions in the past. Just a thought. Let's see. And if I'm allergic to the flu shot, will the vaccine be safe for me? For the most part, yes. And a lot of people will say, "Well, I have a reaction to eggs, or and I can't take the flu shot." Um, a lot of that has kind of been debunked now at this point, but it works through a completely different mechanism. I'd say part of it is trying to figure out if you are really allergic to the flu shot versus you had some reaction to the flu shot. That's a distinction that can make a difference there. If you just say, "Oh, well, I felt bad after I took the flu shot, or I had chills or a fever or that kind of thing," your immune system was responding to the flu shot, which is what it was supposed to do. Versus, I took the flu shot and I passed out and I was in the hospital, I needed an EpiPen, and you had a true allergic reaction to it. Those are very different things. So part of that may be having a discussion with your doctor to figure, are you truly allergic, or did you just have an immune system response to the vaccine? How long will they monitor me after the shot? For the most part, they're having people stick around for about 15 minutes, to make sure there's no initial reaction. And what I got on my phone after I took the shot was to sign up for, there are two monitoring websites that your clinic might use. One is VSafe. You put in your phone number and they'll text you a message to follow up. I think maybe like 2, 4, and 6 hours, and then daily for a week. And then it checks in like weekly after to make sure you're not having any sort of reaction. So ask you some questions. Depending on how you answer, if it seems like you're someone who needs some follow-up, someone may call you to give you some additional guidance on that. But the initial monitoring period is about 15 minutes. What type of pain medication can I take during the vaccine? You can take your typical pain medication, so whether that's Tylenol or ibuprofen. I would lean a little bit more toward Tylenol. There's some literature, especially for pediatrics or for children, that says that ibuprofen can minimize your body's immune system response to the vaccine, which you want your immune system to respond to it. So if it's some minor pain, I would just let that go. If it's a little more something where you feel like you need to take something, I say take Tylenol if you can. You do want to pay attention to the dosing of it. So the maximum dose of Tylenol that you should be taking in a day, if you need to take that much, is 4,000 milligrams or 4 grams. Ibuprofen is 2,400 milligrams, so you don't want to go over that amount. I think, and also with Tylenol and ibuprofen, again, ask your doctor, especially if you're on other prescription medicines. There are some times where I might not recommend one of those for you. So if you've had issues with either gastrointestinal bleeding, ulcers, things of that nature, you do not want to use ibuprofen. If you have underlying liver issues, hepatitis, other issues where your liver has had some struggles or issues, Tylenol is not the best one for you. So again, if you have other underlying conditions, you want to ask your doctor about that. Should I take a Benadryl if I'm nervous about being allergic, or just wait? I would wait for the same reason for that we're talking about the ibuprofen possibly interfering with your body's immune system response to the vaccine. Benadryl is something that impacts really mast cells, and Dwayne will appreciate that comment. But it's something that can potentially blunt, some of your immune response as well. So I wouldn't do it preemptively, if you will. These are all good questions. All right. Let's see. And while waiting for any other questions, some people will ask, what you can do to help boost your immune system, if there are other things that you can do to help prevent you from getting it. I'd say if there are some things that you're wanting to do, things that you can do that help build up your immune system to some extent would be things like vitamin C. So you typically, it's going to be 1,000 to 2,000 milligrams of vitamin C daily. Vitamin D is something that you can use as well. Typically, I would recommend 5,000 international units daily. When you look at vitamin D, a lot of times you'll see vitamin D2 or vitamin D3. Vitamin D3 tends to be absorbed better by the body. Vitamin D2 comes from plants, D3 comes from animals, but your body absorbs that better. Zinc is another one, typically 50 milligrams daily, and melatonin. And I'll send you all the list of this stuff, 5 milligrams at night. These are things that typically get prescribed in the hospital when people have COVID. But these are things that are available over the counter, the types of things that don't typically get talked about quite as much when it comes to nutrition, other natural things that you can do to help support your immune system. But these are also things that help with other viruses, colds, flus, that sort of stuff as well. And what is herd immunity? So, herd immunity is a concept that's important when it comes to vaccinations, because if we have a group of people, so let's say we have a group of 100 people. If we can get, 70, 80 of those people out of that 100 vaccinated, it does help to protect those people in the middle, let's say per se, who don't get vaccinated or those who can't get vaccinated. Which is, kind of what gets talked about a lot of times. Well, we just need to have everybody, get the infection so we can get herd immunity. So lots of people have already have had it. That's all well and good if you're dealing with something that doesn't cause death, to such an extent. So if you're saying that we want to get to herd immunity and we just want to get everybody, exposed to COVID, you're talking about millions of people will die as a result of that. So that's not the kind of herd immunity that most people are willing to accept that kind of risk for. When it comes to the vaccination, if we can get, 70, 80% of people vaccinated, that would greatly help cut down on the risk of transmission for the rest of the population. Because you're always going to have somebody who either can't get vaccinated. So maybe that's the extremely young, infants, the elderly, people with lots of really severe medical conditions, people who have absolute contraindications to getting the vaccination. There's always going to be a group of folks who can't get it. And unfortunately, you also have a group of people who just refuse to get it and still put other people at risk. So that herd immunity will help cut down on the transmission if you're not actively able to spread, the virus to others. All right. And is there a time to get tested for COVID if I am not having symptoms, just to be sure? This will vary by location. So right now, because it is so widespread, lots of locations will offer you testing even if you don't have symptoms. Some places, depending on their resources or what their ideology is, will only test you if you do have symptoms. So I'd say there's really, you can get tested at any time at this point. It is so widespread. If you want to get tested, you can get tested at any time, really, just to be sure. And if I'm having symptoms or maybe weeks after my second dose, do I need to get tested as usual? Yes. Okay. So let's say you've gone through it, you've done everything you were supposed to do, you got vaccinated, it's been a few weeks afterward, and you have symptoms. So let's say your smell or taste gets a little bit off. Let's say you have, fever, chills, you have a cough that won't go away. You should still get tested for COVID. Okay. So even if the vaccine has a success rate, let's say of 95%, okay, if you do get COVID, ideally or hopefully the idea or what we've seen so far is that you have a much milder course. It shouldn't be something that has to send you to the hospital. But that being said, you could still, contract the virus. But if you do, it's a much easier course. Because right now, if someone were to get COVID, I don't have a crystal ball to sort of tell you, okay, well, you will have a mild course, you will have a severe course, and you will have an extremely severe course and you might die from it. I have no way of knowing that. Okay. So that's why it's not something that I'm willing to risk, per se, because there's no, just because I'm, younger, with relatively few medical problems, there's no guarantee that I wouldn't have a more severe course with it. So that's a really good question. Best website to track vaccine availability. There was one that came up recently, that's on, I think, one of the North Carolina State website. Will find it for you. That list locations by county where the vaccine is available. I would look into that, but I would also just stay plugged into your group setting that you have here. So if someone here said, hey, they have vaccines over in Greene County, go to Greene County. Okay. They got vaccine in Nash County, go to Nash, get it wherever. Your state medical, your head of your Department of Health, Dr. Cohen, said if there is vaccine available anywhere, you have access to it. The vaccines don't belong to Wilson County. They don't belong to Pitt County. They belong to everyone. Okay. So if you know somewhere where it is, let everyone else know so you can go get it. And yes, you can definitely travel to other counties to get the vaccine. You can go to another state to get the vaccine. Will the nurse speak with us about risk before getting the vaccine? That will depend on the location about who's giving the vaccine. Typically, the way it works, you will fill out a brief questionnaire that will ask you, are you having any symptoms today? Do you have other medical issues or allergies? So it's a screening questionnaire to see if there may be any immediate risk. But if you have a question, ask it, okay? That was actually one of my notes to talk about. So when you have questions, just like you all are doing today, you want to get an answer to it. But ideally, you should get the answer from a reputable source. Okay, so your cousin posting on Facebook might not be the most reputable source. Okay, so ask the nurse while you're there. If there's something on the questionnaire that triggers a question, you should be able to ask it there. If you're not getting the answers that you need, you can always, call me too. Hopefully, I'll have my phone fixed soon. Let's see, but hopefully, I don't know if you all saw Dr. Fauci on one of the press conferences, White House press conferences recently. Hopefully, you will see more kind of transparent information coming out, from a centralized source, which is going to be helpful as well. Because again, I really don't want people to get a false sense of security, with information that's coming out that's just been frankly incorrect. Can you get the flu shot in the same week? I mentioned this a little bit earlier, but they're recommending that you wait 14 days between vaccines. So just in case you were to have a reaction, let's say to the flu shot or to the COVID vaccine, we know what the issue was. So they're recommending 14 days. Ideally, you should have gotten your flu shot a while ago, but you can still get it now too.
I think that's all. If you can hear.
Okay. So what do people think about that? Was that clear? Is there anything that I said that was not, that raised another question that you had? I want to make sure that it was, plain enough so you got it.
Clear.
Okay, great, wonderful. But again, you may have other questions that come up later. I'm happy to help or do this again, or if you know another group that needs this, let me know. Or if you want to forward questions to me, let me know. That CDC website with frequently asked questions about COVID-19, about the vaccine is also really good. I was actually just looking at that now. So that's a good resource that you can use as well.